Welcome, everyone, to the Pink Ribbon Roller Coaster podcast. We're grateful that you're here with us today. I have a special guest. Her name is Ashley Wray. She is with the company called Natera. She is a PA by training, and she spent 10 years in clinical practice at Texas Oncology in Houston before she joined Natera. She loves having the opportunity to work with patients and seeing more and more patients advocate this test that we're going to talk to you guys about today. So I think the timing of this conversation is perfect. So I invited her here because we recently had our Survivorship Expo in Oklahoma City, and Natera was one of our vendors there. And so they have a test called the Signatera test. I don't know if a lot of you guys have heard of it or not, but I hadn't. So it was really neat to get to visit with them. So I thought this would be a great way to help you guys see what the test is. So first, welcome, Ashley. We're so glad you're with us.
Thank you. I appreciate that.
And first off, let's just start off from the beginning. What is the Signatera test?
Sure. So, whenever you go to the doctor, right, for the very first time, after being diagnosed with cancer, they usually could come to labs, right?
Mhm.
Sometimes it's like to like your blood count to check certain biomarkers called like CA19 or CA125. Um, and so Signatera is a similar blood test to these like conventional biomarkers that we use to try to see like what can to get a snapshot of what a cancer is doing. It's just much more specific than other markers that we have had in the past. So what this test does is it identifies a fingerprint of your own tumor that lives inside your body, and looks for that fingerprint in the blood over any given amount of time, right? So usually, sometimes the physicians will draw the test or order the test right when you get diagnosed. They can draw it while you're on treatment. They can draw it before surgery. They can draw it after surgery, and then even when you're in surveillance, after you've been treated and you're coming for your regular scans, they may also order the test as well. So it's a much better tool in the physician tool belt than previous markers that they've had in the past.
Okay, so let's say when you're talking about the fingerprint, what if you have more than one tumor or
That's a great
one?
That's a great question. So you can actually have more than one assay. So the beauty of this test is that no two assays are ever going to be the same, right? And even if you have more than one cancer, then we would build more than one assay. Even if you have two different breast cancers, we would build two different assays because the the, the unique fingerprint of each tumor helps us better identify like which one is being the problem, right? So you would have two different.
Okay, so how does the test work then?
What happens is the physician orders it through the portal or through their medical record. We then contact the pathology department after we get the pathology reports. From there, we do what they call full exome sequencing. It's just a fancy name for getting the DNA sequence of that particular tumor. It's called the somatic sequencing. We then will ask for a couple of tubes of blood, and they and it looks kind of different when you may be wondering why, if you ever have this test, well, why are there different tubes? Well, one tube is to actually make the assay, because what we do is we get the fingerprint of the tumor and then take a tube of whole blood and cross-reference that with your own um, genome, right? Like with your own DNA. Why do we
Mhm.
want to do that? We want to do that because we want to make sure that the fingerprint that we're tracking is the fingerprint of the tumor and not your own fingerprint. So you know what I mean?
Yeah.
Um, and so we do that. And then once we do that, then we have your own personal assay. And then with subsequent blood draws, we run the blood through that particular assay. So the first time you order the test, or the first time um, the physician gets the test result, it can take a few weeks. And that's just because of all the extra steps that we have to take to generate the assay. But then once the assay is built, it takes about a week for you to get uh, subsequent results.
Okay. So, excuse me, whenever we were talking about if you have multiple tumors, would you have multiple vials to create the assay for each tumor?
Multiple. Yes. So if you had more than one primary tumor, The physician can say, I want to track the left breast cancer and I don't want to track the right blood cancer, or I want to track both. And so if he wants to track both, then we would, have to take a couple of extra tubes of blood. Um, but if he says, I just want to track the left, then it's the same amount of blood. And usually we'll ask for 2 tubes of blood.
Okay. And so, as we are tracking this and we're looking for residual cells, how is this impacting us as a patient? So, I was diagnosed when I was 26 the first
Mhm.
time. Should I just have asked my doctor, hey, at any point can you do this? Or is there a certain timing when you should be asking for this test?
I mean, you can ask for it at any time. This test has only been around for just a few years, right? So really, it's only about 5 years old. So if you were diagnosed, say, like 20 years ago, it would not have been available. So that's why it's still relatively um, slowly but surely becoming adopted by physicians, and other, medical professionals that treat, cancer, like APPs,
Mhm,
PA surgeons.
mhm,
I used to order this test for patients before joining a company. So how it's affecting you as a patient, um, if you think about it, right? Like if you had treatment, say you had treatment before you had surgery, if you knew what your Signatera status was before surgery, that can give a really good indication of your prognosis after surgery, right? So say
mhm,
you were ctDNA positive before surgery, after surgery, now you're negative. Well, that's a really great thing. Why? Because that means that we were able to get all of it out with surgery,
mhm,
and there's
mhm,
nothing systemic.
mhm,
Say it was positive before surgery, you have your surgery and your ctDNA like the amount has gone down in the blood, but not completely. Now that may be an indication that and it is a likely indication that you still have residual disease. And the physician may say, okay, let's scan you. Let's go to the tumor board and see if you need to have additional treatment. Should we escalate your treatment, right? So if you're trying to decide, do I do one therapy? Should I do 2 therapies? This can kind of help guide those decision making, in the treatment journey. And then say you're treated, everything looks great, you don't see anything on a scan, um, and the physician says just come back in a year, for your mammogram. And you can also order this test during that time, because if we notice that it's positive, right? It's negative, negative, negative. Now it's positive. Now we're catching something at a molecular level sooner, and we can try to act on that sooner rather than later, right?
right.
Like, if you can catch disease when the disease burden is low, like when it's much smaller, then you have an opportunity for your treatment to work better.
Right.
Um, Sometimes I think about it in terms of like taking hormone suppression, right?
Mhm,
Nobody wants to take hormone suppression. Being put into menopause is terrible, right? Now, say you've been like on tamoxifen for a really long time, you're tired of it, right? And you want to come off. Um, you know, could you have a conversation we don't have data for this yet, but could you have a conversation with your physician about uh, possibly taking a holiday, right? Um, on the flip side of that, it's also helpful to know your ctDNA status when you're on tamoxifen, because what we know is that if your ctDNA is negative when you're on tamoxifen, that's actually a really good thing. That means your treatment is working, right?
mhm, mhm.
Um, so so there's different conversations that you can have around utilizing the test to help you make better decisions, and then to help the physician make better decisions too.
This sounds really awesome. So, is the test for any cancer patient, regardless of staging, regardless of site, anything like that?
Yeah, so we got our start in colon and rectal cancer. That was sort of where we initially uh, started using the test. But what we know now, after 5 years, is that this test can be utilized for any cancer histology. Now, the way that cancer DNA sheds into the blood can vary based on the type of cancer that you might have. Sometimes cancers will shed DNA into like the thousands. Um, B cell diffuse large B cell lymphoma is a good example. You can see mean tumor molecule values of like 5, 6, 7,000, versus say like if you're hormone receptor positive but HER2 negative, you may shed lower amounts, especially in surveillance and like early recurrence, right? You may see mean tumor molecule values of 0.08, 0.1, but they can get much, much higher. So it's just a conversation to have with the physician as to whether or not, this would be a good test for them to order for you. But it can be used in any cancer pathology.
Okay. So does insurance cover this?
It is covered by Medicare for breast, bladder, let me stage 1 through 3 breast and metastatic if you're on immunotherapy, breast, bladder, colon. Any patient who is on immunotherapy is covered for um, by Medicare. Stage 1 through 3 lung cancer, and similarly stage 4 metastatic lung cancer if you're on immunotherapy. We just got Medicare approval for ovarian cancer and primary peritoneal cancer. So it's covered by Medicare in a lot of ways. Um, Commercial insurances are slower to adopt. We need some more like randomized phase 3 controlled trials that are going to be reading out here in the not too distant future.
Okay.
However, as a company, we're not interested in, putting patients into some, financial toxicity and having them go bankrupt just because they want to know what their cancer status is.
Right.
And so there are ways to get around costs is what I'm trying to say. I am not the expert of that. I will be perfectly honest because since I'm medical affairs, they kind of keep me separate from that. But
Mhm.
just know that even if you have a commercial insurance and you don't have Medicare, that doesn't necessarily mean that we can't order this test for you. Um, and and just the conversation to have with the surgeon.
Okay. That's what I was most curious about because I know a lot of times, like especially whenever BRCA first came out, it was so expensive and
Yeah,
insurance didn't cover it, and there was only one lab that did it, and so it
yeah.
became problematic. And I was curious, how that translates
Yeah,
here.
that's a good point. This is a little bit different than like germline testing because germline testing is so is widely available and it is now accepted by most commercial payers. Um, they're in a different bucket, if you will, on what the requirements are. Since we're still relatively new, this is a great time for us to be ordering the test because we usually don't balance both patients.
Okay. So
Not
if
usually.
some
We don't balance bill patients. I should say that. I can rephrase that. We don't balance bill patients. So,
Okay, so if somebody is interested, you had said they're
yeah.
supposed to ask their doctor.
Mhm.
Um, how do they phrase that? I'd like to have the Signatera test, or
Mhm.
okay,
Yeah, you can, or you can just talk to them and ask them if they're familiar with it. Um, and if they are, that you would like to have it ordered. And what would you need to do to do that?
any
And
physician
then
any physician can do that though, right? Because what if they're not familiar with it, and you're basically asking they should be able to get access to it, right?
correct. Yes. Usually what would happen is when that happens, a lot of times the physicians will reach out to us or reach out to the sales team to set up a meeting. And then we, from, on the medical affairs side, we go in and provide education. And then after that, it's up to the discretion of the physician as to whether or not they're going to order it.
Okay, perfect. Well, I really love the idea of being able to have this option to be able to see, potentially what risks you could have. Now, how does this translate if you maybe are BRCA positive and you have a loved one that is BRCA positive? Is that significant to them in any way?
So that's another great question. So if you don't have a diagnosis of cancer, then like Signatera is probably not going to be the test for you. Um, just because we need the patient's tumor in order to create the assay. Um, so even if you're BRCA positive, staying in those early cancer screening programs, making sure that you're regularly following up with your provider to get those screenings is, you know, crucial.
Mhm.
And then God forbid something happened, that's where this test would be more appropriate. So so yeah.
So I know some girls, especially in our community, they have struggles sometimes getting approval for PET scans. Could this
Yeah.
be a potential tool to use in lieu of that?
Um, in lieu of that, that's another good question. We're still working through, like, from a data standpoint, can I forego a PET CT and just have my Signatera ordered? I we don't have the data for that yet. Um, and what we can, like, and what we have seen, is that sometimes this test can be used to support getting a PET CT approved. So more and more payers now are becoming familiar with genomic testing, not just from a cancer DNA monitoring perspective, but you likely would have had a genomic test to see if you were eligible for certain drugs. So payers now are familiar with these types of genomic tests, and we have seen that this stuff can be used to get those approved. Um, I I would kind of do it with patients because many of my patients were truck drivers, right? And if they weren't driving, then they weren't coming to then they didn't have health insurance. So I would say, okay, fine. Let's order this test for you because you can do it via mobile phlebotomy. That's the other nice thing. Like, we can come to you rather than you coming to the clinic if that's something like a need for you. So I said, okay, fine. I'm going to come to you, and if you're positive, you have to promise to me that you're going to go get your scans.
Right.
And they said, okay, fine. Because otherwise they wouldn't come in for their regular slog. Um, so it can be used in all kinds of ways. But to replace the PET CT, we don't have the data for that yet.
Okay. So when you were just mentioning then about going to the patients, we have a lot of women that live in rural areas
Hmm.
that limited access to care. Would that be a potential option for
Yeah,
those women?
yeah, that's
Okay.
the beauty, and that's sort of like the beauty of this test and sort of the things that we offer. I mean, the goal really for us is to make this as easy as possible, not only for you as the patient, but then also the physician, right? Um, and it can be a challenge to call your granddaughter, to call your son, to call a family member, to pay for somebody to have, like, medical drivers to bring you, right? Sometimes you live 2 or 3 hours away, right?
Mhm.
And so what we quickly realized is that there was a need for this service, and so we do offer it.
Well, that's amazing. I
Yeah,
love
it's cool. It was one of
love
the things
that.
I loved it was one of the things I loved about it, when I was ordering it for patients.
Yeah, I mean, because that's been one of the major challenges for us is really trying to be more aware of the needs of the rural patients, but
Mhm.
also how to help them have access. So that's awesome.
Yeah.
Um, Well, okay, so if somebody is interested, obviously they need to go to their doctor. What if they have more questions and they want to just do some more research? How would they get in contact with you guys, or where should they go to learn more about it?
So our website actually does have a lot of patient information. We do also post different webinars um, that patients have access to. Um, so just going to the website would give you a ton of information. And then if we are starting to, like, look into other, like, patient advocacy events. We're creating a whole team of people to go to be more often, like the Susan B. Komen Foundation event. So hopefully would get to see us there at your event.
Yeah.
We get the opportunity to talk to patients. Those are just a couple of the ways. Um, when you become a patient, you do have your own patient portal, so you'll be able to have access to additional information. And then we have, people that you can call, once
Okay.
you become a patient.
That's perfect. So
Yeah.
basically, they just need to go to natera.com. That's where they need to go.
Mhm. Yep.
Okay.
And
Awesome. Okay, ladies. Well, I hope that this has been beneficial for you guys to learn something new. Seems like a really cool option for, I think, a lot of us. So, like,
yeah,
go
we're
to Natera. oncology.com, and you guys can learn more about it. If you have any questions, let me know. I can get in touch with Ashley. But Ashley, I just appreciate your time. Thank you for being with us today.
Yeah, no problem. We're excited about breast cancer too. Like we've got some really great, exciting data that came out this year, um, looking at your lymph node status. So it's an exciting time to be in this space for sure. And I'm excited for to see how that can help evolve the breast cancer space and evolve treatment paradigms for breast cancer.
That's awesome. Well, thanks again, and we're so glad
Yeah,
you guys
no
joined us.
problem. Happy to do it.
We'll see you guys next time.